My name is Spencer Edwards. This is skill number 26, dependent bed to wheelchair transfer and back. In the previous skill number 25, they went over the precautions to do with how to set up the wheelchair and how to set up the bed height. Follow all of those for these, but we're going to focus on 3 standard precautions for someone with 1, a total hip replacement, 2, a hemiplegic stroke, and 3, a coronary artery bypass graft. The first precaution we're going to go over is a total hip replacement. There are several approaches for the surgeries for hip replacements. We're going to go over the posterolateral approach. The main thing you're going to teach your patients is they cannot do hip flexion past 90 degrees. This includes if they're seated and they lean forward past 90 degrees. Another thing is you want to avoid excessive internal and external rotation of the hip. A good cue is to tell your patient to keep their kneecaps facing forward. So Cody, we're going to transfer you from the bed to the chair, the chair to the bed. Make sure when you stand up, you're not leaning forward past 90, and when you sit down, you're not leaning forward, but you're leaning back and reaching back with your hands, and I'll help you as we do that. So push off as I lift you. Ready, 1, 2, 3. Good, shuffle. And then reach back as we slowly go down. Good. The next precaution we'll go over is a patient who has suffered a hemiplegic stroke. So for this, Cody has right-sided weakness. The main thing that you never do with stroke patients is to pull on their affected limbs. Never pull on them. You're going to have them hug their affected limb to their chest with their strong arm. And then it's essentially the same transfer as you've seen in skill number 25. So Cody, you're going to lean forward right here. Ready, 1, 2, 3. Good. So that was to Cody's strong side. His left side was strong. That is ideal. However, sometimes patients don't have room in their homes to go to the strong side, so you have to do it to the weak side as well. Same thing, but help to guide their knee as they're moving over, guiding their weak knee. Ready, Cody? Go ahead, lean forward, yep. Ready? 1, 2, 3. Good. The last precaution is for a patient who has had a coronary artery bypass graft. The things you're going to instruct them not to do is to never pull on anything with either limb. Don't reach across, don't twist, and then when you're transferring them, instruct them not to hold their breath. All of these things could possibly rip their wound open, so that's why we don't do them. One other thing, they may have pain leaning this far forward, so you may just have them lean this far forward and rest their head against your shoulder. Often, cardiac patients will have a cardiac pillow that you will have them hug to their chest to kind of help them to keep it stable. So Cody, I'm going to have you hug this to your chest. And we're just going to lean you forward to right here. You're going to grab their gait belt, and then it's just a normal transfer. Ready? 1, 2, 3. And then stabilize to make sure that they don't have any loss of balance or fall over.